Hi, my name is Rebecca Copping and I am a CQU student doing Bachelor of Nursing. My student number is 120808839. Now this is for wound care, and today I'm going to be talking about Mrs. Jones and her leg ulcer. So firstly, thank you for referring Mrs. Jones. I have assessed her picture and her venous leg ulcer and understand why it's smelly, painful, and has an increase in exudate. This venous leg ulcer is usually a result from peripheral vascular disease that is due to venous insufficiency or venous hypertension, and yes, a compression stocking will help immensely. I trust a full assessment such as time has been performed, checking things like the temperature of her foot, check her pulses, capillary refill, ABI assessment, size of the wound, which we have, and probably wouldn't hurt to get some blood workup done, CBC, ESR and her transferrin levels, because this can also cause anemia. So, due to her obesity, her BMI being 40.2 and a probable sedentary lifestyle, I'm sure that this is affecting her quality of life. But good news, I can assist her and redress her wound. So wounds like this are usually located on the medial malleus, and this wound also has irregular edges. So I note that the wound is a ruddy red, has loose slough, undermining or possible tunnelling is evident. I note that the exudate is increasing, the wound is malodorous and has a stringy yellow slough. This indicates infection. So we will take a swab to determine the pathogen and most likely need to start her on systemic antibiotics. She also may need topical therapy down the track. Her surrounding skin is scaly, which usually goes with this condition, but I would recommend Cavalon Barrier Cream 3M from her chemist. Want to try and protect the rest of her leg. I note that she is pain from 4 out of 10 and then on moving 6 out of 10. This is usually a dull and aching pain, and I would advise her to follow the advice from her GP, take her regular paracetamol and ibuprofen for the pain. So because of the high exudate of the wound, this wound needs to be redressed until it lessens with exudate. Because if we don't redress the wound, then the surrounding tissue can cause maceration, and we also need to protect her clothing from seepage. So I'd recommend up to 3-4 times a week changing this dressing until the exudate becomes a lot less. Okay, so yes to compression therapy. Stockings will definitely help, as this promotes healing through aiding venous return, increasing the healing rate. This is the secondary dressing, and elevate the leg to help with pain. So with regards to cleaning the wound, I would use a aseptic non-touch technique and use sterile water. The wound may need debridement, and an antimicrobial dressing is best because of the high exudate. So the primary dressing of choice is Zituvit, which is a highly absorbent, multi-layered dressing for heavily exudated wounds. It's soft, comfortable, and most importantly, it's cost-effective. And it can also be used under the compression bandages. I note also her medical condition, that it's important for her to keep her type 2 diabetes under control, as well as her hypertension, along with her weight. Unfortunately, her medications can have some side effects. Thank you for referring Mrs. Jones today. Thank you.